Ready? Hello everyone, this is Dr. Piyush Dubey from Pet Medics Small Animal Veterinary Care Center, Bilaspur, Chhattisgarh. And today I am going to do a phacoemulsion cataract surgery in a 8 years old Labrador female. She has a mature cataract, and the main complaint was that she was banging in a wall and obstacles. So we have examined her and we found that it is a case of mature cataract, and we are going to operate it today with the help of phacoemulsion technique. So this is a very delicate surgery, and things can go out of control at any time. So if things goes out of control or become messy, I will either mute this video or may even end the live stream. So let's see how thing goes. So here, for those who are new to the phaco, I would say I'll ask my attendant to give a quick look about the setup of the phaco machine. So this is a phaco machine, and this is a phaco probe. This is a phaco probe that goes inside the eyes, and there are various instruments. We have to position the eyes and the patient head to get the level of eyes parallel to that of a operating microscope, and then we are going to operate it. So let's start with the surgery. So can I have some more visco, please? So मुझे scissors दे दो, कैंची दे दो मुझे थोड़ा सा. I'll cut this. थोड़ा सा दूर से बड़े zoom करके बनाओ. Okay. So the first step I'm going to do is I am going to make a side port to enter in the anterior chamber. There are different ways. You can go for a single port or a double port. I've been trained by doing it by a double port method, so I'll make a small port and then a main port. So pila wala dena mujhe, pila wala. So here I'm making a small port. And then I need phecoemulsion injection. This phecoemulsion injection is basically a local anesthetic that will provide a good intracranial analgesia and will dilate the pupil as well. We have to be very cautious not to touch pupil. Can I have a dye, please? So now थोड़ा ढीला छोड़ना उसको. So now I'm going to place a dye. and I need a gel coat with this visco again. थोड़ा पानी डालते रहो बीच बीच में, इसको वॉश करते रहो, वॉश करो, जल्दी वॉश करो। NS So now I will make a main port. Making a main port, I will adjust the microscope a little bit like this. So I'll first give a small lick there at the limbus, and then I'll go inside. So here we are. Now I will do a rexis. सुई कहाँ है? मोड़ के रखना है अभी. For doing the capsular rexis, I have to bend the needle in a definite fashion, give a nick inside the capsule, and मुझे दूसरी needle देना. Now I'm going inside, and I give just a cut in a capsule, and that is it. Now with the help of a haldi cooker forceps, I first need some gel coat. So I'll go and put a पानी डालना थोड़ा सा उसमें, NS. NS डालो थोड़ा सा जल्दी. So now I'm going inside. Just do a quick. I'll again give some visco as my chamber is collapsing. And I have, yeah, so I've successfully done a capsular access. Hope this will hold the lens. Complication called PC tear can, posterior capsule tear can happen anytime. And in that case, it is very difficult to place a lens. So now I'll start my phaco. इसको सेट करना, वैक्यूम को 300 पे सेट करो, वैक्यूम को 300. चॉपर का है, चॉपर भी चाहिए मुझे. चॉपर स्ट्रेट वाला, स्ट्रेट राउंड मिडिल है ना. हाँ यही तुम हाथ में पकड़ो, खोलो उसको. हाँ वैक्यूम सेट करना 200 पे, 200. ये नहीं, ये ऐसे एक और दूसरा चॉपर 300 पे, वैक्यूम 300 पे सेट करो. 300 पावर 70. पावर को सेट करो, इसको 200 पे करो. और I'll again give some visco inside first. थोड़ा इसको तुम हाथ ऐसे रखो सीधा. Yes. पावर को 70 करो और उसको 300 करो. वैक्यूम 300. So now I'll be going inside. I'll again have some visco. तुमने फिर इधर कर लिया, इसको ऐसे खींच कर दो बेटा. Go inside. That is good. I'm breaking the lens in two pieces. I'll try to get this rid of bubbles. Actually can. वैक्यूम थोड़ा बढ़ा देना, 500 तक करो उसको, पावर 90 कर दो. This is how I'll again put some visco inside to protect the corneal endothelium, because that is more important part of the surgery. And I'll go in a linear mode. रुक जाओ. Yes. अब करो 400 में, वैक्यूम सेट वैक्यूम 400 में, और पावर 80 में, और इसको 24 में कर दो. Aspiration 24, 24, 25. So this is how we have removed all the lens material that was clogged, and now I can able to see, even you guys can able to appreciate a yellow sheen coming from inside the eyes. If yes, then we have cleared all the lens material, and I don't find any lens material left, और मुझे फिर से फेंको देना, and even I don't find the need of polishing the capsule. फेंको वो देना मुझे, विस्को देना, और नया विस्को दो, विस्को 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 निकालो जल्दी. Interior chamber looks synced, it's a bit synced. We'll put, दिखाओ मुझे दिखाओ. I'll put some visco at the top. Now I will try to put lens. It works. मुझे थोड़ा सा वो भी देना, आरएल अंदर डालने के लिए पानी. From the microscope, I can see that the posterior capsule is not very intact or funny then, and the chances of its rupture while placing a lens are more higher, as this is a long-standing case. This patient was suffering from cataract from past few months, so I'm not going to place a lens. The lens are only important to do help in image resolution. The main site from where the vision is occurring is retina, and that retina is healthier. So even if we don't place a lens, there are good chances that this dog can able to see. If there's a phenocane injection or the other phenocane injection, phenocane निकालो जल्दी से. As this posterior capsule is very much bulging inside, the space that we have made after removing of lens, they are minor there's a very minor bleeding that I'm encountering from iris, and so I'll close this here itself. And the phenocane that I have put inside is actually a local anesthetic with adrenaline that will help in stop the bleeding. I'll also put an intracameral injection of moxifloxacillin. मोक्सीफ्लॉक्सिसिलिन का इंजेक्शन होगा एंटीबायोटिक का, देखना जरा. नॉट रिक्वायर्ड. हाँ, मुझे थोड़ा सा वो देना आरएल फिर से. I'm again going to flush this a little. I'm putting intracameral moxifloxacillin. inside, and I will now close it. 80 दे देना. I will close the cornea. Visco. So here in this case we cannot able to put a lens because I don't find the posterior capsule very healthy to properly hold the lens, and there are chances that if I have 80, if I have tried to put the lens, that will actually rupture the posterior capsule, and everything will be very much disturbed by then. So I'm not placed lens here. I am just trying to close the incision. फिर से वो देना RL. So these cataract surgeries and intraocular surgeries, they are very much delicate, and anything can happen at any point of time. So we have to be very much ready for everything, and always should have a plan B ready. So bleeding is almost stopped now. मुझे फिर से एक बार वॉश करना. RL. There's a minute injury to the pupil at the site of incision. पानी डालो ऊपर से, इसको डालो. विस्क को थोड़ा सा ऊपर से डाल दो उसमें. We have to apply this viscoelastic material over the cornea again and again, and have to irrigate the cornea either with Ringer's lactate again and again, just to prevent the dehydration of So you can see there is a little bit of bleeding inside the anterior chamber. That is of फिर से थोड़ा फ्लश करना.
अगर आइवरमेक्टिन लगाया है वो कौन सा डॉग आया है डबलमैन और गोल्डन रिट्रीवर को लेकर आते हैं ना वो तो आइवरमेक्टिन दिया तो इमिडेक्टिन सिम्पेरिका दोनों दूं या एक ना
yeah. So I will be cutting this large ends of now I will try to flush the chamber with my side port. So the blood clot, small blood clots that you guys can able to see, they are actually good and been resolved in a 2 to 3 days time. Just to prevent the posterior capsule further bulging out, I will inject some air inside. And will close like this and will just close. मुझे पतली सुई लगा उसमें by hydrosealing. पानी उसमें सिरिंज में लगा के दो मुझे। So hydrosealing is basically injecting a RL solution. So hydrosealing is basically a sealing of a cornea with the help of fluid. And we are done with the procedure. So there are a small clot left inside the eye, and that is from the bleeding from iris that will eventually uh, vanish away in 2 to 3 days time, and this dog can able to see nicely. However, the eye is aphakic as we have not put any lens, so uh, this dog will not able to see the things very clearly, rather the vision will be a little blurred, but that is okay in case of a dog as his other senses are very good and he can able to live his normal life. So before closing this, I'll go for subconjunctival injection of amikacin and triamcinolone acetate. फोर्सेप देना मुझे, फोर्सेप। सफेद वाला इंजेक्शन कहाँ है? So this is it. We have done with the procedure, and thanks for watching. So this is how a phacoemulsion is done in case of dogs. So thank you so much, and we'll live stream some more surgeries soon. Thanks for watching. Take care and bye.